Mental health is a person's condition with regards to psychological and social well-being. It affects how we think, feel, and act. It is an integral part of our overall health, including how we deal with stress, how we relate to others, and the decisions we make. Mental health needs to be prioritized for each person and the society they live in. It is important because it helps us to cope with the stresses of life, work productively to reduce anxiety, and to reduce risk of depression. When our mental health is affected, it affects not only the individuals but the entire family. They hinder young people's development into healthy and productive adults. Good mental health helps our children, or youth and adults, to develop resilience to cope with whatever they are dealing with in their present lives, such as natural disasters, war, poverty, violence, climate crisis, and diseases. Mental health should no longer be a taboo topic. It is a human right. We need to feel safe in our countries, homes, schools, and environment. Such issues such as global warming, natural disasters, diseases, wars, and food insecurity can have a devastating impact on our mental health and well-being. By prioritizing and talking about mental health, we can ensure that our nations and people are equipped to cope, withstand, and be resilient in the face of such challenges. As a family, mental health has become a daily conversation, especially after COVID. Everyone in my family has been affected in one way or another. My eldest son and his wife experienced the loss of their first baby in the early stages of her pregnancy. It was during the lockdown period in our country. They were together, alone in their apartment, which gave them time to support and grieve together until both families could get together to give them more emotional support. My youngest son has had a hard time socializing with friends face to face. He has spent most of his time online for school, for entertainment, and with friends. When he had to go back to school for his final exams, it was extremely difficult for him. He needed therapy and support. We ask questions, we make them understand that it's okay to be sad, anxious, or even depressed, but they need to talk about it and ask for help. Mental health is no longer taboo in our house. We need to support our children no matter how difficult the situation may be. It's hard to see a family member suffer in silence and alone. Families need to support each other and get help. Currently, the Ministry of Health and Wellness in our country is working on a comprehensive mental health policy that will outline a strategic plan to prioritize and place mental health at the forefront of meeting all health needs of Belizeans. The Belize National Mental Health Program provides mental health support across the country. All clinic numbers and providers throughout the country have been posted on social media and media houses as another option for easy access. Belize is also working very closely with PAHO and WHO on the Mental Health Gap Action Program. This program aims at scaling up services for mental, neurological, and substance use disorders for countries, especially with low and middle income. The Ministry of Health and Wellness also provides psychological first aid training for police officers and other public officers that may need training. Mental health stories that have inspired me are stories of resilience and overcoming mental health issues. When persons suffering from mental health illness have bounced back positively and have been able to build strong positive relationships with loved ones and friends and are now in a position to provide support, guidance, and acceptance.